1. Vomiting in pregnancy. It is a common problem when a woman is pregnant. The main symptoms include vomiting, weight loss and fluid and electrolyte imbalance during the first 6 months of the pregnancy. If vomiting is too heavy, it would impact on baby's development, but no worries. Your situation is not serious. Most women during pregnancy have the same problem. You need complete bed rest and the doctor has ordered an oral medication and IV therapy for you. I see. I can understand why you are thinking this way. Especially, it is your first time to be pregnant. Many women in your same situation feel the same way. They don't want to take any medication. They don't want to harm their babies, but don't worry. The medication is actually vitamin B6. It will relieve your vomiting. It is effective and safe for both you and your baby. Many women with the same problem have taken the medication. It has been used in clinic for many years and there are no unpleasant side effects. The IV therapy will be beneficial for you and your baby. 2. Tonsillectomy. I do really understand why you are feeling this way, but no worries. A tonsillectomy is just a standard procedure, a small operation. Most children have the operation in their childhood. After the operation there may be things like having pain, fever, and difficulty taking fluids. The day after the operation, everything would be fine. Pain would be controlled very well by pain medication. Please take the painkiller regularly, and if the pain worsens, you should contact a doctor immediately. If you have trouble breathing, swelling or bleeding, you need to contact a doctor immediately. Using a humidifier at home can also bring some comfort. It is a good idea to avoid crowds or ill people for the next 7 days, since the throat is highly susceptible to infections during this period. Food should be soft and not too hot. Ice cream is better. Cold food and drink would prevent the wound swollen and bleeding. I suggest to eat soft, easy to swallow food and to drink a lot of cold fluids.